military is being called in to help bring COVID testing into secondary schools and colleges in England. Some 1,500 personnel will provide support for the testing scheme, which aims to help students return safely in January.
The government is pressing ahead with plans for primary school, older secondary school and college pupils to return in early January, despite scientists claiming a delay is needed if rising infection rates are to be brought under control. We asked people in Huddersfield whether they think children should be returning to school.
She might get behind on her schoolwork and things like that, but I think what's ever best to get everything back up and running again if it does help in the future.
If we're not safe enough to be interacting with a bunch of people, I don't think that I'd feel that it's safe for my kids to be going around mixing with a ton of different households.
We've got to make it safe for everyone, and I do understand that, but I also think education is really important.
I'm a trainee primary school teacher, so I've seen the effects that it has on children of being away recently because of the pandemic, so I do think they do need to be in.
Well, joining us now is member of Independent Sage, Dr. Zubaida Haque, General Secretary of the Association of School and College Leaders, Jeff Barton, journalist and mother of four, Rosie Millard, and journalist and mother of two, Gemma Forte. Good morning to you all. Dr. Zubaida Haque, I'll start with you because should children be going back to school? You've got the inside track really on what's going on with COVID. Is it the right thing?
I don't think it's a question about should they be going to school, should schools be open or shut. I think the key question is, are schools safe enough right now? Can the government make schools safer? And in making it safer, can we then keep schools open? Right now, we have a crisis situation. Yesterday, we had the highest number of daily COVID cases, over 41,000 cases of coronavirus in this country. And by Christmas Day, we had more patients in hospital with COVID than at the peak in April this year. So we are in a crisis situation right now. Government has delayed opening Parliament because we're in a crisis situation, and yet yesterday we heard Michael Gove saying, no, it's fine, we're going to have schools open next week and we'll have a staggered return. And frankly, that's not acceptable and that's not safe. Not until we make schools safe.
So how can we make schools safe then? What could be done? Some easy measures.
Well, since June, Independent Sage have been saying we need to have smaller classrooms. We need to have children spreading out much more across many more different classes as opposed to 30 children in one classroom. Social distancing is impossible in that way. We need better ventilation. We need face masks for secondary school children in classrooms. We need more laptops for children so that they can do remote learning. We are absolutely clear that education is essential for children. Children need to be at school, but they don't. They shouldn't be at unsafe schools. And that's where this government have wholly failed. They haven't made schools safe. They talk about mass testing, and that alone isn't going to make schools safe.
Jeff Barton, let's come to you at this stage then. Do you think that schools are safe enough? Is this plan for mass testing going to work to be able to make sure that schools are a safe environment for children to go back to?
Well, good morning, Charlotte. I'm an educationist by background, and I listen to the scientists speaking with such passion and clarity. And of course, that's going to raise exactly the question that you asked there. Now, the people I represent, school and college leaders, did everything they were asked to do in order to make sure there was a sense of social distancing, keeping children in bubbles in schools. And the question is, therefore, are the arrangements we had in December the right arrangements for next week? And, you ask about the mass testing, and we hear about troops today. We know that when the mass testing trials were taking place, which we hugely support because that's what's going to keep more young people in school instead of whole bubbles being sent home, but that was run by the army and by health experts. What we're hearing today, given we've got 3,500 secondary schools in England, are 1,500 members of the armed forces who are going to give online support, webinars and so on. So I do think we need to be absolutely clear and say to ministers and the Prime Minister, if scientists are saying what you've just heard there and they think it's not safe, how do you as a Prime Minister or a Minister know better? What's the evidence for that? What's the rationale for business as usual next week?
Rosie, you're in favour of children returning to schools, but you've just heard Dr Zubaida Haque from Sage, so she knows what she's talking about, saying that as things stand, the way schools are, that's not a good idea.
Well, the recent surge happening over Christmas happened because of Christmas mixing, happened because of shops being opened. There's scenes in Regent Street, in Nottingham, in Manchester, of furious amounts of people in marketplaces, in shopping malls. I think that we are in a real danger of wrecking generations' life chances if they don't go back, if children don't go back to school. UNESCO has cited 13 adverse effects from denying children going to school, including social isolation, interrupted learning, poor nutrition, a disaster for the economy, because, of course, if primary school children don't go back to school, parents have to stay at home, look after them. The whole last term was a complete chaos with whole bubbles being sent home. Children need to be at school. Teachers need to be on the top priority for vaccination. I think testing is very good. I think it's a very good idea bringing the army in. Everyone knew that children were going back to school in January, and to only have teachers now being told of what's going on is a complete shambles. We all knew that children were going to go back. Year 11 and 13 have got to go back for mocks. My children go back for mocks next week. Those might not happen. Their exams have already been scaled back, with various core subjects not being taught. Children, my son's school doing GCSE English, are not being asked to analyse a novel. I think that one might agree that learning about novels is a key element of GCSE English, not this year. It is just, the repercussions of this are going to last for years and years and years. And the fact is, mercifully, that COVID does not seem to affect children, young people, as much as adults. The BMJ did a survey of 651 children, which was 2/3 the amount of total children admissions to hospitals. Sadly, 6 of that number died. Those children had underlying health issues. That is 1% of children with COVID.
Rosie, the argument with children is that they spread it. So they may not die, but they spread it to the rest of the population, and it stays in the population.
Let's speak to Zubaida there, because you're nodding your head. What would you like to come here about the transmission risk with children and what the knock-on effect of that could be?
Yes, absolutely. I completely agree. Children need to be in school, but they shouldn't be in an unsafe school. And we know from the previous variants of COVID, yes, it's true that they didn't infect children, but we have a new variant now. And just as we've got a vaccine that's coming around the corner, this new variant has changed the game, because not only is it 70% more transmissible, but with children, and this is really, really important because it explains why infection rates were so high just before Christmas in schools. With children, we think it makes them more infectious. Now, that's a huge problem, because schools are, if you like they're children mixing factories. There are lots of children in small classes and in small buildings, and that's going to have not only a dangerous impact on the school, but also on the community.
Many children cannot learn at home. They haven't got laptops. They haven't got rooms. They haven't got pieces of work. They haven't got books. They haven't got the initiative. They haven't got the support they need. You can't expect a whole generation of children to be learning at home.
OK, so actually it's about getting that equipment in place. Gemma, let's come to you, because we haven't spoken to you yet, and you're obviously keen to join in at this point. I know that you're a mother of 2, and Rosie there is talking about, the concerns about wrecking children's life chances, but we're also hearing from Dr Zubaida there about the transmissibility of this new variant among children. Do you think it's a risk too far for them to go back at the moment?
Well, I think this whole idea about whether they go back or not is just such a binary question. We all agree that the best place for kids is school, 100%, and we're exhausted. And the thought of my kids being at home, again, fills me with dread, of course. But if you send them back too early, they're going to be back home within 5 minutes anyway. The schools were limping to the end of term. Both of my kids had a spell of isolation as it was. So Why rush the return before it is safe? It is quite obviously incredibly infectious out there at the moment. And I completely disagreed with what Rosie said about, oh, it's okay, the kids are safe. There are teachers in those buildings going in every single day. We have family as well. My children are very worried about infecting me or infecting their dad. And that goes sort of throughout society. And we've got this government who've made these decisions regarding education, sending universities back, the whole debacle with the A-levels and GCSEs. And I feel like here we are again, making these huge pronouncements, having come off the back of last term, threatening to sue schools in Greenwich. It's incredibly disconcerting. And I think teachers across the board need support at the moment, not threat. And not this whole idea that, if you say you don't think it's safe for children to go back, you're not putting children's best interests at heart. Of course they are. Its safety and their health is linked to wealth. If your child goes off sick and then you get it yourself, you're going to be off work anyway. So I think cautious. Let's get each school feeling that they are ready so that the kids can go back and have a continuous term rather than going back and being disrupted.
And Jeff Barton, coming to you, there seems to be a lot of frustration about the lack of forward thinking, the lack of planning when we're looking ahead, and people are talking about provision for remote learning there and that situation just not in place. There is this concern, isn't there, that actually more steps need to be taken to be able to get children back into school safely, or if the alternative is that they're going to have to learn in a different way, that provision needs to be there.
It certainly feels like we've got a Corporal Jones of a government. We're always one step behind. The guidance in terms of what we are trying to do from the 4th of January finally came out with detail the day before Christmas Eve. But I do think what Gemma said there is a very important point, that it doesn't have to be binary, this. It doesn't have to be all young people in school or not in school. And what I would say to the government is the people who best know their communities, who best know what facilities young people have got at home, whether it's IT or whether it's books like this, are the school leaders and the teachers. And what we could be doing is reducing the number of young people in school initially while we get that testing in place, making sure we focus on those young people who we need to have in school, trusting the other ones not to be in school. And why don't we have a more nuanced debate about it, a more grown-up attitude? And why don't we trust our school and college leaders, who frankly are looked to for real leadership by their local communities?
OK, Jeff Barton there, thank you to you. Thanks also to Dr Zubaida Haque, Rosie Millard and Gemma Forte. Thanks very much for all of you. And thanks to you as well, actually, for getting in touch. We have had so many comments on this from lots of people who I think it's fair to say there is concern about it. Isabel's got in touch. I work in a primary school. I live in Tier 4. I'm worried about going back. I've kept myself safe and not seen loved ones over Christmas, and now I have to trust 26 families in my class have done the same. There's been a lot of comments from people echoing that.
Steve on Twitter on the issue of schools. I'm a lecturer in a further education college, and even though I was not allowed to see my grandchildren over Christmas, they still expect us to be back in class with 20 students on the 4th of January, and we have no idea what those students have been doing over Christmas. So...
Gemma, however, does point out my children really suffered when schools closed last time, mentally and emotionally. It took a real toll on them both. I would like to see schools stay open. So the government has got the situation under review at the moment. We'll wait to see what more details there are.